So how will this change to per capita health care funding affect you and your family? BC leads the country in terms of an aging population. The province is home to one of the highest life expectancies, not just in Canada, but anywhere in the world. And that means that there are more people living longer and costing the health care system more. So who's going to pay? You. CTV's Joe Perkins reports.
She's a 72-year-old retired nurse living in James Bay who walks every day.
Yeah, absolutely, absolutely.
She has spent her life working next to the province's healthcare system and knows healthcare costs for seniors tend to increase with age.
It's a little bit here, a little bit there, but everybody's got their little bits in. And pretty soon it's like, wow.
It's one of the reasons why she questions whether a per capita funding formula is fair in a province where 1/6 of the population is over the age of 65.
Certainly there is a case to be made that healthcare costs rise with age, and with an older population you tend to have a more expensive patient, as it were.
In a report from the Canadian Institute for Health Information, per capita healthcare spending last year went up drastically with age, with nearly $20,000 separating the country's youngest and oldest demographics.
Because it costs about 10 times as much to provide health care for a senior citizen as it does for someone in their 20s.
Meaning the federal government's new plan could leave provinces such as BC looking for ways to meet a price tag that is growing.
It's that old, whether it's my federal tax dollar pocket or my provincial tax dollar pocket, the tax man's probably going to be tapping me on the shoulder.
It's how Dr. Prince foresees the province meeting its healthcare costs and why the Premier is calling for an adjusted payout.
I think a per capita by age, recognizing the age, would be maybe not a bad idea, but per capita straight across the board, I don't think is a good idea.
It's not just a fiscal problem, it's an issue of how do you actually look at the healthcare system with a different eye.
Chrétien agrees and suspects a revised health transfer plan, especially one based on a per capita formula, could upset a large portion of British Columbians.
Governments are going to have to figure out how to sell to the public the idea of they're going to have to raise revenues to maintain quality health care and quality public services.
It's a route the Premier doesn't want to take, but with an aging population, a one-time federal payout would likely not be enough to meet the province's rising health costs. Chrétien says some tough decisions need to be made, one she hopes she doesn't have to pay for.